Welcome, everyone, and thank you for joining us for today's employment webinar, Vocational Rehabilitation. My name is Melissa Edwards, and I am the Transition Project Manager for Project Power. Project Power is funded by the Rehabilitation Services Administration, which supports parent centers in Arizona, California, Colorado, Idaho, Nevada, New Mexico, and Utah to build capacity for transitioning youth with disabilities and their families. To get the best experience, please keep your mics off. You will be muted for most of the presentation. Please use the chat to ask questions. We will answer them at the end of each presenter. If you prefer to ask your questions out loud, please use the raise hand function in the reactions section at the bottom of the screen. This webinar is being recorded. We will send out the recording along with resources and a survey for you to fill out. We will also put a link to the survey in the chat 5 minutes before the end of the webinar for you to fill out. Today, we will be spending our hour in partnership with Arizona's Raising Special Kids and Diverse Ability Incorporated. Let's get started with Kathy from Raising Special Kids, who will introduce our first speaker.
Thank you so much, Melissa. As she mentioned, we are going to talk today about youth and employment. And in fact, this is the first of 3 webinars that we will put on for parent centers. And we couldn't do this without the work of Melissa and her team there with the Peak Parent Center in Colorado. So I'm Kathy Gray Mangerson, and I work for the Arizona Parent Training and Information Center, which is Raising Special Kids. And I am so pleased and have been so honored to be able to be in partnership with another Arizona organization and putting these together for you, which is Diverse Ability Incorporated. And I'm going to let Reggie, who's been a fabulous partner in doing this workshop, tell you a little bit about what Diverse Ability does in Arizona. You're muted, Reggie.
I just caught that. My name is Reggie Mitzel, and I'm with Diverse Ability Incorporated. We are a nonprofit organization in Arizona, and we primarily work with young adults who have disabilities, helping them transition from youth to adulthood. We have a variety of conferences and workshops that help those young adults learn self-determination, self-advocacy skills, goal setting, etc. So it's a perfect partnership for us to work with Raising Special Kids, who work primarily with parents of children and young adults who have disabilities, and our focus is on the young adults. So this partnership was really natural and wonderful. So I want to thank Kathy as well for all of her work, and Melissa.
So we are putting on 3 webinars about youth and employment and different aspects of those that we are sharing with all of you from parent centers who are on here. And we're going to try to keep it as high level as we can with information that would be the same nationally, but there might be some, your organizations might be called something different and that kind of thing. So when we have a link or an opportunity to share with you how to find these organizations in your state, that we're going to do that. And this might give you an opportunity to then take this information and start thinking about, what do we want to do for parents in our particular state? So this is the first webinar. The second one will be on August 29th at the same time, and we will be talking about Workforce Innovation and Opportunity Act, or WIOA, and Pre-Employment Transition Services, or PREETS. So please, if you're interested in that and available, please register for that. And then the third one will be on September the 19th, and we will be talking about the Centers for Independent Living and what they do to help youth with a variety of issues.
So all of our webinars, what they have in common is we're capturing the ideology of employment first. So all of our states have either legislation, executive orders, or some kind of state agency regulations that all support employment first. And that's a belief that employment should be the primary day activity for all working age adults, including adults who have disabilities. Employment first encourages interagency collaboration, and we want to promote those state agency employment systems and policy change. And of course, one of those state agency employment systems is vocational rehabilitation, and you'll hear about that today. Employment First believes that with the right supports and services, we'll have a better chance at having employment outcomes. It supports community integration for all, and it also aligns with the intentions and expectations of WIOA and health and community-based services. Employment First has a vision of making employment the first and preferred outcome for persons who have disabilities. It believes that everyone can work, although that may look different for each person. And people should be able to find work in their own communities and be given the supports to be able to do that work. It also states that people should get the same wage, whether you have a disability or not. And a person's interests and preferences should guide job choice, not just throwing people into cookie cutter jobs, but listening to their needs, their wants, and their choices in employment.
And there are a number of different agencies that can help with that. But when Reggie and I were thinking about this, the first one that came to mind for us was vocational rehabilitation. So in a minute, you're going to hear about them. Now, to find out what the agency is called in your state and which government department it's under, here's the link for that. And you can click on that and you could go to your state and find out what it's called, where it lives, and that kind of thing. And in a minute, we'll tell you a little bit about Arizona's. Schools also help with this, with transition plans. In Arizona, that is age 16, but it might be a different age in your particular state. There are also workforce centers, families are very involved. So there's lots of people in the youth life trying to help them with careers and employment and where they're going and what they're doing next. And so in Arizona, the vocational rehabilitation is under the Rehabilitation Services Administration, or RSA, and every state has an agency like this. It might be called something slightly different, might be in a different department in your state. In Arizona, they're under the Department of Economic Security. But that link on the previous slide will show you how to find this agency in your state. So I'm just going to give a little brief couple of thoughts about VR, and then the people I'll introduce in a minute will tell you everything you need to know about that. But they help people with disabilities regarding employment, finding out what they're interested in, preparing for it, entering into it, retaining it, helping them receive the training and the education and all those kinds of things that they need. And I am super honored today to be able to introduce Stephanie Chapman and Claudia Merrims, who are vocational rehabilitation counselors in Arizona. And I have known them for a very long time. They are very knowledgeable about the services that youth can receive through them. So they're going to talk quickly about who qualifies and how do you qualify and what are the steps and what do you need to do and what do they do to help you and that kind of thing. So without further ado, what I'm going to do is I'm going to stop sharing my PowerPoint so they can share theirs and tell you a little bit about vocational rehabilitation. So thanks for coming today, ladies, and we're really excited to hear what you have to say.
Thank you so much, Kathy. We're really pleased to be here today. My name is Claudia Merrims. I've been a vocational rehab counselor here in Tucson, Arizona, for over 8 years. I couldn't believe it when I went and checked. It doesn't feel that long. I happen to be what we call a TSW, or transition from school to work counselor here. Some states have specialized counselors, and so we have I work exclusively with high school and young adults. And I'm so pleased to be presenting to parent centers because I'm often making referrals and working with people like Kathy or sharing information with the families and the youth that I support. So thank you all for everything you do and being partners together in supporting success. And I'm so pleased to introduce my coworker and good friend, Stephanie Chapman.
Hello everyone. My name is Stephanie Chapman, and I'm also a TSW counselor out in Tucson, Arizona.
So as we share information today, we're actually going to go over the orientation that we share with youth and families about our program, and hopefully you'll find it informative.
So, what is vocational rehabilitation, or as we like to refer, VR? VR is a work program. You must want to work in order to qualify and receive services from VR. VR helps people with disabilities prepare for, find, and keep jobs. VR helps you prepare for a job. VR does not find you a job. To summarize, because we are talking about youth, so it's a work program, but if you are still in school, then of course, we don't get you a job right away. So what we do is we provide those services, those job skills, and what does the job look like, everything that you need. So then when you are ready to get the job, you're ready to go.
And how does VR help people find or keep jobs? If folks are eligible, they'll receive services through VR. Together, we'll work in selecting a job goal. The job goal will need to have a good outlook. As I joke, if we would have a ton of video game testers if we didn't do that. At least a lot of the youth I work with, that's their number one job goal. And so we have to see that it's something realistic and it has a good outlook. We'll help the youth to identify, or the individual to identify what skills they have or are needed to achieve the job goal. And we'll provide services to help you get and keep a job. We have a menu of services. They're all individualized based on the person's needs. I'm just going to mention a few of the services we have. We have some evaluations or assessments that may help us in planning and guiding. We may have training or further education that's required for a job goal. We may have job coaching and help and assistance finding a job. We may have access to assistive technology, but it's all really individualized based on each person. We'll provide services, as we said, to help and get you keep a job, and we'll support and work together during the process. And typically the client and the family is really the leader, and we're all partners in the decision-making process.
I like to say collaboration.
Yes.
We're collaborating together. Alrighty, so how long does this take? So the process of vocational rehab. Step 1 is an orientation. It says you are here because this is where we would start when we're speaking with individuals and their families. Step 2 is an application and an intake. That intake is an interview where we ask you everything about you, your struggles, what you've been working on, what you need to work on, all that good stuff. Basically, what does your life look like, and so that we can better understand how we are going to assist you if you're found eligible. So step 3, eligibility. That's where we take everything that you have provided for us, documentation, information, and we determine if you are eligible for services. And then step 4 is rewrite your plan. So we have 2 timelines. Between step 2 and step 3, application and eligibility, we have 60 days to determine an individual eligible. And then between step 3 and step 4, eligibility and writing the plan, we have 90 days to write your plan after eligibility. It can be less. It just depends on how much documentation you provide, how much additional information do we need to create that plan to make sure that it's going to work for you. After that, while you're in plan, we go to step 5, where you participate in the services that we've agreed on. And then step 6, you get hired.
So what will that application and intake meeting look like? We call it our interrogation. We do ask a lot of questions during the intake meeting. So really, if you're supporting families or applicants, they need to be prepared to talk about disability. If they deny that they have a disability, we can't assist them to finding a job. So sometimes we run across that, and it's really helpful if people are prepared that that's going to be a tough conversation, but they may need to talk about their disability and how it affects them at work. We also say how it affects them at school because our clients are a little bit younger. Okay. We are a work program, so we do require a social security card ultimately to receive services, and we ask for basic background information, sometimes sources of income. We talk about any past work or volunteer experiences. I also talk with youth about their hobbies to get information that way as well. We'll talk about people's education, and I'll also talk more specifically with younger people about where their favorite classes, where they're struggling, where they're succeeding. We'll talk about any job goals they have, and any challenges they see in achieving that job goal. I don't know if we're gonna go ahead.
I was just going to ask before we move on to the next slide, Kathy, are we answering questions? We see someone has their hand raised.
It's completely up to you. If you want to answer questions as you go, you can. We have put time at the end of your presentation to answer questions. So whatever is easiest for you is fine with us.
Hello, Aru. Do you have a question about the?
Yes. Here the second part is social security card, address, contact info, and UB. Like their families are coming from varieties, kind of things. Like some are like I have a son who is 21 years old and is in 20 years old, and he is in transition. In December he will come out of transition. I have question, like he doesn't have a social security card, Miss SSN he doesn't have, because we are not eligible for this SSN. But we have IT number, like uh, in this condition, how we help the parents and other people, and for my son also. Miss, because you are asking me, you are saying like social security card is must. So what for the other people who doesn't have security card?
That's a great question. I'll try to address it. Steffi and I can jump in maybe a little bit. And partly we're sort of saying what we do in Arizona. There could be states that look at it a little different. So we sometimes get a birth certificate and other forms of ID. Whatever the federal government kind of accepts as forms of IDs that are alternate to social security cards, we can accept. Sometimes for certain services, we may have a step in our plan to assist the person in receiving accessing a social security card in the future if they're able to. I'm not sure if that helped address, and Stephanie, you can jump in as well.
So
Basically,
the items, go ahead.
Basically, for us, like we are in a queue of taking citizenship and green card called permanent residency. When you are in a queue, you cannot take any federal or state funding. Means not SSN, any state or any federal funding you cannot take. In this case, what should we do?
So I know that we asked for this information because it's something that an employer would also ask for. So there is an I-9 documentation that that has a list of items that you can use. So one step maybe to be looking at that list and seeing if there's something on there that you have instead of the social security card. The other thing that I would suggest is when you contact your local rehab administrative office in your state, to ask them what they require, because each state might have different requirements that you might be able to utilize.
Okay, thank you.
Thank you for your question. So I'm going to talk a little bit about step 3 eligibility. So you, in order to be eligible for VR, you have to have a documented disability. That disability has to create challenges at work. You have to have the ability to work in a job which pays at least minimum wage, and you need VR services in order to work. Circling back to number 1, you might want to ask, what kind of documentation do I need to prove my disability? The documentation is usually doctors' medical information, because we do work with young adults and students. We can utilize the IEP and the MET from the school, as well as maybe some evaluations that you may have had. Anything that you have that documents your disability would be helpful in turning that into vocational rehab. And if you meet all four eligibility criteria, then the staff will determine your order of selection, which Claudia is going to talk about on the next slide.
So some states have an order of selection. Okay. When I describe an order of selection, I say it's kind of like a wait list. At times, there's been too many people that needed VR services, and states didn't have the ability to provide the support to everybody. And so they had to come up with a priority system of who got services first. Okay. So here in Arizona, we do prioritize. So we have priority category 1, which is the highest disability related needs, priority category 2, significant needs, and priority category 3, all other eligible individuals. As I said, thankfully, we don't have a waiting list, so to speak, or we can serve everybody in all our categories. But in the past, we did, and it was people in category 3 that had to wait and check in with us regularly. I'm thrilled to say that we don't have a wait list or order of selection, excuse my language. And I did check that most states, even if they prioritize, don't have a waiting list right now or people waiting for services. So I'm pleased to share that information.
Step 4, when writing the plan for employment, as Claudia mentioned earlier, learning about job trends and the skills. So that job trend is that job, will that job be available once you're done with your plan and learning those skills that you needed? Not only that, but will your disability, is the job that you're wanting to pick appropriate for you as far as your skills and abilities. So we also look at that. And then, when you're talking about when you're finding that out and when you determine that that's a good job goal for you and that it's attainable, you decide on the job goal, and then you determine the steps needed to reach that job goal. And then you write the plan that includes the services to help you reach that job goal. So the plan is made up of the things that the individual is going to do to reach their goal and the services that we provide to help them reach their job goal. Claudia, I don't know if you wanted to expand on that any.
I think you did great. I think one thing to point out, especially when we're working with youth, is sometimes the plan is over several years and the plan can change. Okay. I always point out that we're working on a first plan. I support individuals that are in amendment or plan number 15. We expect things to change. People change as part of the program and growing, and that's absolutely okay.
Yes, thank you for adding that, especially working with younger individuals. The person that you meet the first time isn't the same person that you meet once you start working with them for a couple of years. So yes, that plan will most likely change.
So the 5th step is participating in services. Folks will participate in services to address challenges caused by their disability and prepare for work. It's not easy preparing for work, and VR is an agency here to help and support people in that process. As we said, it could be several years that you have a plan in place. So it's really important to have good communication with your VR counselor. And we ask for monthly. In our state, if we lose contact over 3 months, you could be at risk for closing. Once again, to remind people that employment is the main focus of our program. So we're going to tie everything to that. That being said, I love partnering with other agencies. The more we work on independent living skills and other things with other entities that people may be involved with, or self-advocacy and self-determination, the better the outcome for everyone. So reaching and partnering and working together towards the employment goal. People need to be committed and actively participate, and just treating each other with respect in terms of appointments. But if it's going to be the family and the individual, they're going to need to reach out if we can't get in touch with them.
And finally, step 6, getting hired. So the vocational rehab process, after 90 calendar days of stable employment, you are considered successfully employed and your case will be closed. Now, I stress stable because if we check in on you and we see that you're not doing well or you're having some difficulties, we are not going to close you. We're going to step in and see where we can assist. So we don't leave anyone hanging if they're struggling. But once we do find that you're stable, you're doing well, then we will close successfully. And you are employed, you no longer need VR. We tell you congratulations and good luck in your life and future and bid you a fair adieu.
So we have another visual of some of the information we just went over. So we like to call it our roadmap. So just to summarize, the first step is an orientation where we share information about the VR program. The next step is an application and intake appointment, and we do an interview to get to know the individual and their strengths and needs. Then we have 60 days to determine eligibility. Then the next step is writing a plan, and we have 3 months. So we'll typically meet frequently to get to know the individual and come up with a plan that reflects their strengths and needs. And then the next step is participating in services. And the final wonderful successful last step is number 6, when people are employed and no longer need us.
And that concludes our orientation presentation.
Melissa, are there any questions in the chat?
There are not any questions in the chat, but if anyone has any, you can go ahead and place them in the chat now or raise your hand.
We have a hand raised. Go
Yeah.
ahead.
I want to ask you, is it some specific time candidate should learn the skill in that specific time, participate in services like 5th step, right? There are 60 days to check the eligibility, 90 days to write the plans, and after that, that participate in service is having some specific time. Like it depends on that child, right? Whether I have a son, he has his own ability and his skills. Might be he will take some more time to learn the skill, or some people take some less time to learn the skills, right? So this time may be vary from or it is a specific time.
It should vary, yes, because like like you said, your son is different than everyone's child is different. Everyone's different in learning those skills, and it might take someone longer than another individual, or it might take them. They might pick it up really quick. So the counselor would be able to gauge. Okay, well, they might give you a timeline, but if they see that timeline hasn't been met, there'd probably be a follow up as to what's going on. Do we need to change anything? So it could be quite a while depending on what's needed and what services are required and the ability of the person.
Can I
You
jump
want to
in?
add anything to that?
Yeah. And then also part of the plan is individualized, for instance, based on your son. So there might be an intermediate objective that talks about some skill attainment that has a specific date. So when the plan is being created, you want to talk about a realistic timeline. And if things change, we should be reviewing and revisiting that plan and updating it as needed. So there's no specific guidelines. It's individualized for everybody.
Okay, so the first step is we have to contact our local rehabilitation center, right? Means like I am in Colorado, so where I have to contact first? My local means how I know that this is the agency where I have to contact. Basically, I am new here in America, and everything I have to learn or ask somebody, right?
So after this presentation, you will get a copy of the PowerPoint. And on the slide that I already went through, there is a link that you will click on, and that will take you to all the vocational rehabilitation offices in the country. So you would look for your state, and that's where you would start. And then based on that, they might send you to another office or things like that. Here, we have offices, and certain kids in certain schools go to certain offices, but you can start with that link, and
Oh,
that'll at least get you to maybe the administration office, who can then tell you who you need to talk to after that.
okay. Thank you. Thank you.
Robin, you have a question?
Yeah, I had a couple of questions. Do you guys have like a formal online application that you do? I know you did the interview. Is that in lieu of an actual application, or is there an application somewhere in your system?
So there's both. At the time of application, you would do the intake. That's where they find out a little bit more about the individual. I'm not sure if you can apply before you speak to someone, Claudia.
Yeah, I think our process is we receive a referral,
Mhm.
and then and then there is when we do the intake interview, we also fill out an application. There is paper and there may be an online application as well, but we like to help people through that process. So when we receive a referral, then we reach out to assist people with the application process if needed.
And generally, is that done in person or is it done online?
The
The interview.
We can speak for our unit. It's personal preference. If someone can't make it out to our office
Sure.
or to a site, then we're more than
Mhm.
welcome to do a virtual appointment. But it is varied by your state, what the office
Right.
is
Okay.
set to
Well,
do.
also,
Also-
Stephanie and Claudia, I want to thank you for being here. Thank you for doing this.
Thank you.
Appreciate that too.
Yeah.
I just have a couple more questions if I could. How do you involve families in this process? So many times we have youth that are transitioning and they're not quite ready to be that independent. So do you have different strategies that you use to ensure that families can be part of this?
So that's a great question. I really appreciate that.
Mhm.
We're a little unique with our unit, so I also
Mhm.
want to make sure that I address like the bigger picture and questions as well, because we partner with schools, so we reach out both to the student and the families
Okay.
throughout the process. That being said, we really encourage, especially during the intake interview, sometimes some families want to provide a lot of information and really want to hear from the youth and the client about what, it's the starting off point in our relationship and getting to know them. So we're really going to look towards them. And sometimes some, people who want to help are kind of chiming in and maybe waiting to the end to offer that information. That being said, also, the youth or the person can invite anybody to their intake meeting that they feel like can support them in the process.
Mhm.
Then we sign releases if we're able to share information. There's all different types of support and family support that our youth have. Some are legal guardians, some are supported in decision making. I'm gonna reach out to anyone that youth feels comfortable with that's going to help them to be successful.
Good. Okay. And does the Parent Center in Arizona attend those meetings sometimes to give additional support? Do you find, because we actually do that in our state. Our Parent Center does attend VR meetings to kind of help support the process.
We don't, those aren't at the typical meetings we do, but it doesn't say that we couldn't.
Mhm.
So, if Claudia or Stephanie called me and said, we've really got this unusual situation, I would probably more help the parent offline to understand it. I will tell you that my son has been through VR, and I'm
Mhm.
particularly happy to hear there's no order of selection, because when he went through, there was an order of selection. But I would say the hardest part of being a parent with an adult child with a disability was having them go and meet with VR and talk to the counselor. And I wasn't as involved in that process because we wanted him to be independent, to speak for himself, to eventually get a job, and those types of things. So I would say that for a parent center and a parent who's been through this before, I would probably talk to the parent in advance and prep them and give them ideas and that kind of thing, versus going to an actual appointment, because our whole thing is to let the youth speak for themselves versus the parent doing what we've always done. And I tell everybody who will listen to me that the hardest age of having a child with a disability is when they're an adult and they have to start to speak for themselves, because I just want to jump in and do it all, and I can't. And so we could go in certain situations, but I personally would handle that a little differently.
Okay, so we do a little bit of both. We certainly do prepare the family, and generally it's not VR asking us to support the situation. It's the family who is running into a few bumps in the road kind of thing. And they're asking to make sure that, they can, because again, the family sometimes has got these high expectations. And then sometimes they can encounter individuals within our VR that don't always share those same high expectations. And so, yes, we do want the student to speak, but we also feel like families can model for students ways that they can advocate that in certain situations. So
And Robin, we've got a youth we want to speak, and so I'm going to
good.
cut off the
Good.
questions now so we
Sure.
can get the youth to do that. And then if we have time at the end and people want to ask more questions, Reggie wanted you to just talk for a minute about what are some examples of plan services? What do you do education trainings program? Do you pay for college or a tech school, or any kind of additional training type of thing? Could you spend a minute just talking about that?
So some examples of plan services, yes. So VR will provide support for an education or training program if the job goal requires training or education. We also provide job developers if necessary. We have programs where they can go get some skill building, transportation, assistive technology. Like Claudia mentioned earlier, they are individualized plans, and so services vary per plan per person. But yes, we do provide education or training if required for the job goal.
Thank you.
Thank you. We're going to now transition, and Reggie will tell you what's coming next while I put the PowerPoint back on.
Wonderful. So you got a chance to hear about vocational rehabilitation from the professionals. And we also wanted to let you hear from the side of a young adult who has used VR services. So I'm gonna wait a second for the slide to show up for Isaac. All right. So with us today is Isaac Zwinger Nathanson, and he is a young adult who has utilized VR services on his path to employment. And I want to back up really quickly and give you a little background. Isaac began his journey with our nonprofit, Diversibility Incorporated, back in 2017 when he attended our signature program, which is Arizona Youth Leadership Forum. And by the way, VR comes and speaks at our Youth Leadership Forum as well. So Isaac became a leader in our organization. He went through further leadership training and skill development and became a peer facilitator. So he now helps facilitate the youth leadership forums, person-centered planning, workshops, etc. And a very cool thing, he graduated from the University of Arizona last May. He will share more about his story, but that was a huge goal that was in his person-centered plan, which he completed. And I'm very proud to say that Diversibility Incorporated, we're youth-run and youth-led. 51% of our board of directors must be young adults under the age of 30. And currently, Isaac is the chair of our board of directors. So with no further ado, I will hand it over to Isaac, and he's going to talk about how he was introduced to VR and his journey with VR for employment. All right, Isaac, when you're ready, take it away. You'll have to unmute.
Hi, everyone. I am Isaac Zwinger Nathanson. I am grateful to be here and to be given this opportunity. I was introduced to vocational rehabilitation in, what was it? It's been a long time. Middle school, basically. There were programs that for a person with blindness, which I have, there are programs specifically designed to help me and other youth with with blindness learn blindness skills. This would be you learning AT. This could be learning assistive technology. It could be to utilize and learn how to use a cane. It could be learning to cook, clean, that kind of stuff, daily living skills. But also doing these things, we were blindfolded, and all of this was done in a safer environment, but the blindfolds were to kind of ensure that you were learning the blindness skill of in case what happens if you lose your vision and because a lot of blindness, are progressive diseases that can take your vision at a moment's notice. You can wake up one day and have no vision. So the idea of these things were to help you with that. So I got introduced with VR through that and other blindness, the blindness community things. So I insisted VR, take me in as a client early on. And I think I was 15, one of the younger, 14, 15. I probably was bugging them at 12, frankly. I'm very eager to do the next step and not very patient sometimes. So I'm working on that. But the next thing was I went to a school for the blind in Arizona, and we had a vocational counselor that was specifically for us in the Tucson area. And so I met with her 4 or 5 times on different occasions prior to being accepted as a client, or before I even did my intake, just to talk about some of the things that they would do, that to kind of get ahead of the game a little bit, so that I could kind of plan accordingly to what VR is going to help assist me with. Once I became a client, I went through their intake process, and you heard a little bit about that, doing some of that stuff. But I also, because I had bothered VR for a little bit and I had gotten to know the counselor and the process, I hit the door running, and I asked for, I immediately asked for services. Some of those services were over the summer programs, where I went to Colorado, or I went to another state to receive blindness skills. They helped me to kind of figure out what my goals were and to, help me to navigate that sphere. I will say that my plan has changed a couple times and is currently changing, but I'll get to that in a minute. VR has helped me to receive technology. I'm currently using a computer that VR purchased for me. It is a computer that has assistive technology, specifically for people who have blindness. It's a screen reader and magnification software, along with some other things that I needed to go through school. VR has also helped me to figure out what college I wanted to go to, or more specifically, helped me to navigate that sphere of higher education. As Reggie mentioned, I did graduate college cum laude at the University of Arizona with a bachelor's degree in psychology and a minor in food systems, and am currently looking at other programs for the next step. VR helped and assisted to pay for some of the college expenses, books, and some of the tuition. I did receive a very nice scholarship from the University of Arizona for my hard work in high school, and it was several year multi-thousand-dollar grant, not grant, scholarship, as well as some grants that I did receive. So, you know, VR didn't pay for all of it. I worked my ass off to get my education, and it paid off. But VR has also helped me to navigate some of the sphere of employment, and I worked with Arizona Youth Leadership Forum to kind of build my plan, person-centered planning, to kind of help figure out what the next steps were. Diversibility Incorporated as a whole has helped me to, you know, stay employed and do some of the things that I enjoy doing and engaging with youth with disabilities. But VR has, you know, really done a fantastic job with assisting me in my journey. Currently, right now, I'm working with VR on changing my IPE, which is the personal plan of employment, or IPE, sorry, personal plan of employment. When I first started VR, I had this deafening desire to work as a lawyer, specifically as a U.S. Prosecutor. That has since changed. I found out very quickly that I don't like being stuck in a cubicle reading legal jargon for 8 hours. That's not fun. I'm sure many of you could have imagined that as a young kid. That sounds great for a long time, but when you get into the nitty-gritty, it's not fun. So now I'm currently working with a vendor to change my IPE and work through the system to kind of figure out what my next goal is. But I have an idea that I want to work in occupational therapy, specifically as an assistant, and then maybe pursue a master's or a doctorate to be an occupational therapist itself, and not the assistant. So that's kind of my journey. I think some tips and things that I would recommend for youth, but also for parents. A big thing for me is that, you know, we mentioned, let your child be independent as much as they can. That's a huge thing. You can't, you know, you have to let the child decide what they want to do. It's very intuitive and imperative that you do that. I know it's hard, but my parents instilled in me that they're going to hold me to the same standards as my siblings who don't have disabilities. And it's not necessarily throwing me to the wolves, but I can't learn and be independent and grow if I'm being kind of hovered over. And I know that's, you know, hard, but you gotta let them make their mistakes and learn the things that they're going to learn. Another thing I think is really important is to stay connected with your VR counselor. If you haven't talked to your VR counselor in a couple months, just send them, you know, have your youth, or if you're working with you specifically, talk to your youth about sending a cordial email saying, hey, I'm doing this, and this. Apologize if I haven't reached out or needed anything. This keeps VR from closing your case, but also, you know, from wondering where you are. They don't have time to chase you around. So, you know, be with that. The other thing I would say is, be willing to work with VR and be willing to go through the process. You might have to, you know, you really will have to ask clarifying questions and be sure that you understand what the services VR will provide. And if you hear things like, oh, this you heard me say that I got VR to pay for some of my college expenses, that might not apply to you and your family because of other reasons. It could be funding, it's different rules in different states. Just your case is going to be your case, and then no one else is going to be similar. There are very few cases that are similar. There are many cases that are similar, but you won't receive all the same things. And I think that's important when you're working in this working with VR, that you don't compare yourself to other stories that you've heard. You can ask about it, but VR at the end of the day has to determine whether you qualify for those services. And that's kind of where I am at with VR. VR has helped me to gain the skills that I needed, and I've also used my resources and my support to get where I am in life as well. So I think it's a mixed, it's a tool, and it shouldn't be the only tool though. It should be one of many tools that you have in your arsenal of to get your young adult and or yourself in a place of employment.
Thank you so much, Isaac. We have a few minutes to take questions if anyone has questions for Isaac. In the meantime, I will let you know my colleagues are going to put a link for the survey for this session in chat. We would love you to fill out a survey, let us know what you think of the session. So please watch for that link in the chat. But in the meantime, we have some time. Wonderful. We've got some time here at the end to take some questions. You can, if we want to stop the share screen, we can see if a hand goes up, or we can check the chat. Perfect. Or Isaac covered it so well, there are no questions. So does anyone have any questions, whether it be for Isaac or VR? We can take any questions here at the end.
I actually have a question for Isaac. What advice would you give to other families who might have youth that aren't as precocious, perhaps, or determined as
I think for to help your youth to kind of understand, I think it's asking the basic questions of what would you like to do, and kind of getting them to think. I know there are many states in this call, or we're serving not just Arizona, but I would encourage you to maybe look at a youth leadership forum. Shameless plug, I know, but I think it's important that youth get the skills that are needed to be able to speak for themselves. If they need a little assistance, definitely have them talk to someone who they feel can support them, and utilize that support. And again, give them that nudge, but also, try to be encouraging and supportive without hovering. I say this and know what it's like. I'm not a parent, but I'm a godfather, and I know how easy it is to step in for someone, who is young and doesn't know better. So I think, I get it, but I think it's important that for my perspective as a youth with a disability, it's important that you step back a little bit as well as your youth learns these skills and can speak for themselves.
And
We
as
do have a
Kathy,
few more minutes.
oh, sorry.
Go ahead, Reg.
And as Kathy mentioned, the video will be shared with everyone, and we have a fact sheet that we're sending as well that lists some resources, including the link where you can connect to VR in your state. So that will be forthcoming.
Another thing I will mention, and we mentioned it too, if there is someone in this, as a support, there might be another youth that you've heard, or, that is a little, who's gone through the system, and you can ask a youth like me to, you can have VR list me as a support, and they can reach out. I'm not to kind of be in some of those meetings. It's not limited just to the parents. If a youth decides that another youth is going to be their best support, I would encourage you to do that as well, because that's peer support, and I think that's important as well. I would recommend that is another avenue to look at. I'm not saying specifically me. I don't know everyone and I don't know everything, but I think if a peer can be there to support another peer, it'll go a long way.
Thank you, Isaac. Well, we want to thank all of you for being here today, our participants, as well as our wonderful speakers, and of course, Project Peak for putting this on. Again, the session evaluation is in the chat, so we ask you to please fill that out. That helps us take any recommendations or things we can do to improve in the future. And again, this is one of 3 in a series of employment webinars. Our goal is to give parent and training information centers as many resources as we can. So when you are approached by parents and families, you have this arsenal of tools, as Isaac mentioned. Our next webinar is August 29th, where we're going to hear more about pre-employment transition services. And of course, in Arizona, VR also runs the pre-employment transition services, but they contract with a lot of other organizations that actually provide that service, like work readiness skills, job shadowing, etc. So we're very excited to kind of take that next step and share some of that skill building that you can share with parents and families. The registration link is also in this PowerPoint. And if Quinn or Kathy wouldn't mind putting that into chat, that would be great as well. We hope you're going to register for all 3. Again, thank you for being here today. It's 12:56, so if there's any final questions, we can take those. Otherwise, thank you for coming, and we hope you have a great rest of your day.
Thank you, everyone.
Thank you.
Thank you. Thank you for having us.